Welcome to Season 7 of the Institute's Child Welfare Podcast, where we delve into the efforts of child welfare leaders as they explore innovative strategies to support system-impacted parents and caregivers. You'll hear about how these individuals have navigated through challenges, celebrated triumphs, and uncovered invaluable lessons along the way. Today, we're joined by Luke Waldo.
Thanks, Lisa, for having us today.
And we're also joined by Clare Anderson.
Hi, it's so good to be here. Thanks so much, Lisa.
So thank you both so much for being here. I was fortunate to be invited to the Children's Home Society's Wicked Problems convening last September in 2023 and had the opportunity to meet you both and get to know a bit more about your work in the prevention space. In particular, you both speak regularly about the complicated relationship between poverty and neglect in child welfare, which is a topic of national conversation and certainly here in Florida. So one prominent piece of this conversation revolves around the effects of poverty being mistaken for or interpreted as neglect. Many experts are calling for not only better distinguishing of poverty and neglect, but also concerted efforts to address root causes of poverty and eliminate unnecessary child removals and holistically support family well-being. So I'd like to start by providing some context to our listeners. Data consistently show that neglect is the most common reason for removal in the child welfare system. Can you help me peel back the layers on that a bit? What is neglect and what is it not?
Well, thank you again, Lisa, for the invitation to this important conversation and the opportunity to share the stage with Clare, from whom I've learned a lot over the years. I wanted to start the same way that Jennifer Jones from Prevent Child Abuse America often starts this conversation. And she did so on the podcast that I've hosted for the last couple of years. You may remember, as you mentioned, the Wicked Problems convening, that she shared the stage with me and Brian Samuels from Chapin Hall and others in our opening panel to answer this very question. She does that by providing definitions of neglect, as those definitions should really be guiding our understanding and practice. I'm going to start with Wisconsin's definition as I come to you from Milwaukee, and then I'm going to follow with Florida's definition because there is one specific difference between those definitions, and I think it makes an important point. Wisconsin's definition of neglect is focused on the caregiver's failure, inability, or refusal for reasons other than poverty to provide necessary care, food, clothing, medical or dental care, or shelter that seriously endangers the child. So Florida's definition is similar, but you will notice one important difference. It reads, neglect occurs when a child is deprived of or is allowed to be deprived of necessary food, clothing, shelter, or medical treatment, or a child is permitted to live in an environment when such deprivation or environment causes the child's physical, mental, or emotional health to be significantly impaired or to be in danger of being significantly impaired. So you may have noticed that the only real difference is that Wisconsin excludes poverty as a reason for neglect, while Florida does not. It is also important to note that nearly half of all states in the U.S. do not exclude poverty from their definition of neglect. As you've heard, neglect is very complex. Like poverty, it's a constellation of issues, and those issues rarely surface overnight, but develop over time and often snowball, leading to an overload of stress on the caregiver and can have very damaging effects on a child's development and well-being. So what neglect is not, is it's not universally defined and understood. What that means in practical terms in Wisconsin is that nearly 9 out of 10 reports of neglect are unsubstantiated for maltreatment, meaning that the family does not become involved in the child welfare system. And unfortunately, they often do not receive any supportive service either. I'm going to turn it over now to Clare as she can provide some further context.
Thanks so much, Luke. And that's great context setting. This variability across the states in their definition of neglect is important. And much of the research, translational research that we've done helps us also understand that this variability among state policies gives us a window into our more in-depth understanding of neglect and abuse as well. One important thing that I'll also say as it relates to the definitions, we are beginning to see states heighten their legal standards as it relates to the substantiation or removal of children from their families. We've seen states as diverse as Washington State and Kentucky begin to make changes that reflect our increased knowledge and understanding of poverty and economic shocks as root causes of child welfare system involvement. Kentucky's recent change from 2022 in Senate Bill 8 is quite interesting. It narrows the definition of neglect to situations where a child's welfare is harmed or threatened with harm by parent due to inadequate care, supervision, food, clothing, shelter, education, or medical care necessary for the child's well-being, when financially able to do so or offered financial or other means to do so. So we're beginning to see states be clearer about this shared responsibility of maintaining stability in the household so that children's basic needs are met and we are not intervening in the lives of families unnecessarily.
Thank you both so much for providing that clarity. I think it really helps to highlight the variability that we're seeing across the country. So, Claire, in a previous role, you helped set the national agenda related to child and family well-being, including supporting states with initial implementation of the Family First Prevention Services Act, or FFPSA. Can you provide some insight on the original intent of FFPSA?
I think the name of the act says much of what we need to understand. The Family First Prevention Services Act. We're putting families first. We're providing prevention services. The act creates flexibility to provide services and to move funding from paying for foster care to pay for prevention services. So I think the Prevention Services Act really hearkened a new day in this nation and shifting from the government's use of its most intrusive and punitive intervention of the removal of children from their families to a system in which there's new resources or the new ability to use resources to keep families together, to strengthen families, and to address needs that have led historically to over-intervening, unnecessarily intervening in the lives of children and families. I think most of the US would be shocked to learn that by the time a child turns 18 in the US, almost 40%, it's about 37% of children in the US will experience an investigation from Child Protective Services. Recently, I heard a family member who has been involved with the child welfare system say, that knock on the door stays with you forever. I think Family First gives us an opportunity to reduce the knock on the door and dramatically reduce our use of foster care.
So what have you seen go well as part of FFPSA so far now that we're a couple of years into implementation?
Family First has really changed the trajectory of the nation. Nearly all states have submitted a prevention plan to the federal government to implement the Family First Prevention Services Act voluntary prevention program. And of the almost every state submitting and beginning to implement Family First, about 20 of those states either have currently included in their plan what's being informally referred to as a community pathway, moving Family First Prevention Services out into communities where families go to traditionally to receive supports and services. So we are really seeing this enormous appetite and demand to do prevention and to move prevention as far upstream as possible so that families don't even hear that knock on the door.
I fully believe that our shift in the narrative and how we think about child welfare's role in families' lives has meaningfully shifted because of family first, as well as just broader conversations about, as Claire pointed out earlier, the oftentimes life-changing impacts of that knock on the door. I'll share in this conversation later where there's been a lot of energy in our initiative over the last 2 years that I think is a reflection of what Claire just said and some of the broader impacts of Family First on our thinking. And that's really around how practices like mandated reporting have pushed many of us who want to support and help families to reporting families to a very intrusive system who oftentimes don't have the jurisdiction or the capacity to support the families in the ways that they need. And so I think there has been a significant shift in thinking, which has, of course, led to better investment in prevention services and further upstream approaches.
It's also led to, I believe, the reductions that we are seeing in the number of children entering foster care. Since the passage of Family First, that entry rate, the number and rate of children entering foster care every year has been on a downward trajectory. And so we often hear impatience and urgency to implement more of the Family First prevention services and programs and to claim the federal dollars in reimbursement for those programs and services. And that is absolutely the case. We want to see more services and programs getting to more children and families, and the federal government participating fiscally in that effort. What we should also understand is that this change in mindset and the change in practice, even just the availability of new services and supports to families, is, I believe, an enormous contributor to this reduction of children entering foster care.
And what areas do you see as being more ripe for growth for FFPSA?
As I mentioned a moment ago, states are truly starting to understand the evidence of early prevention and using prevention to reduce the likelihood of foster care entry. And that's how the piece of legislation was really crafted, to reduce the likelihood of foster care entry. And so I think what we're seeing are states interested in upstream prevention. We see states investing in concrete supports for families. Earlier we talked about Kentucky narrowing its definition of neglect and including language about food, clothing, housing, if the family is financially able to provide those, or providing financial supports if the family does not have them. We also see Kentucky including concrete supports, flexible dollars to pay for things in the lives of the family that could help bring additional stability. I think that this upstream thinking and investments in concrete supports are the direction that we are seeing states begin to go.
I think the opportunity that I've seen with FFPSA and just this broader conversation over the past 2 years in particular has been the opportunity, one, as Claire's going to elaborate on much more in this conversation, on what is prevention when it comes to foster care entry. We've really started to understand the profound impacts of concrete and economic supports on the reduction of child welfare entry, right? And seeing the importance of economic stability in families as a prevention approach to child welfare involvement. It has pushed us to reimagine prevention altogether in this space. I think, secondly, there's been a greater movement and intention around systems coordination, this understanding that there is no child maltreatment prevention system. There are many, many effective prevention approaches like home visiting, like economic and concrete supports, like family resource centers. However, there is no system that binds them together, that coordinates them in a meaningful way, that allows families to experience them seamlessly, that allows families to not have to tell their story again and again and again to unique providers. And so I think there's a real opportunity to start to bring those prevention partners together, those systems that have oftentimes not spoken to one another or understood their roles in a way that will allow families to feel empowered and also, in some ways, universalize them so that we can start to reduce stigma around some of these prevention services as well.
A great point. And Luke, you're a fellow podcast host, and having hosted the last 2 seasons of Overloaded Understanding Neglect, I know you've talked about the strong families, thriving children, connected communities, 4 critical pathways, and you touched on some of those just now. So those are economic stability, social connectedness, community collaboration, and workforce inclusion and innovation. So these have been common threads in my conversations with other guests this season as we explore how to support parents and caregivers. So I'd love for our listeners to pop over to your podcast to get more depth on this, but could you share just a little bit about those pathways and how they function to reduce removals cited as being for neglect?
Thank you, Lisa, for mentioning the podcast. I'm also encouraged to hear that you have been having conversations with partners in Florida and in this podcast that align with the 4 critical pathways. That doesn't surprise me, but it's encouraging. And it doesn't surprise me because we at the Institute for Child and Family Wellbeing, we function as a translational body. We have an academic partner at the University of Wisconsin-Milwaukee, and I work at Children's Wisconsin that works in the child welfare, the child maltreatment prevention space, mental and behavioral health, et cetera. So we have the oftentimes unique opportunity to address these issues from both a community and practice approach while marrying it with the latest kind of data and research in the field. And so we came to these 4 critical pathways after a very extensive year of community roundtables. And then we reviewed what we learned from our community partners from both rural and urban communities with what was showing up in the data, what was showing up in the research. I say I'm not surprised because we heard from families, from professionals in the field, that these 4 areas were really what was underlying the overload of stress that families were experiencing that could lead to child neglect. And then the data reinforced that. I'll try to provide a little bit more kind of Wisconsin context that I hope reverberates throughout Florida and the country. First and foremost, the idea behind these critical pathways is to really bring together diverse stakeholders from across our state to align our current and future work, to amplify our voices and the effectiveness and impact of interventions, and help us focus our attention on these underlying root causes to create meaningful change. So as our Institute co-director, Gabe McGahey, often says, we may be preaching to the choir, so let's make sure that the choir is singing the same song at the same time and in the same key. So first, economic stability, probably not surprising to your listeners, but we heard time and time again in our community roundtables from families and professionals across our state that neglect was too often caused by families struggling to find a safe, affordable home, or they were facing eviction. We heard stories about lack of childcare and transportation, which makes it difficult to get and keep a job for many caregivers. But we know that when families have access to concrete and economic supports, they can focus on their child's growth and well-being. We also know that nearly 85% of families investigated by Child Protective Services in the US earn below 200% of the federal poverty line. So this pathway really aspires to find solutions that may reduce family poverty, housing and food insecurity, and improve access to affordable childcare, transportation, and healthcare, just to name a few of the many opportunities. So our second critical pathway is focused on social connectedness. For children to truly thrive, they need safe, responsive connections with caring adults. And yet in this past year, the US Surgeon General announced that we have an epidemic of social isolation and loneliness in this country, where nearly half of adults have shared that they feel lonely and don't receive the social and emotional support that they need. We also know that too many of our overloaded families are experiencing crisis, and when they are, they're much more likely to be vulnerable to a child welfare report if they do not have that social or emotional support that can help them navigate that crisis. In this critical pathway, we're really asking the question of how might we create or strengthen the social infrastructures and connections in the lives of caregivers that can help them meet their own needs so that they're better equipped to respond to the social and emotional needs of their kids. So the last two critical pathways are a bit more focused on the systems themselves. So as you mentioned, workforce inclusion and innovation. This is really two critical issues, at least in Wisconsin, and you could make the argument in most states. Our workforce often doesn't look like or have the experience of the people and communities that we serve. And then the other point is that our workforce is often overloaded with stress themselves, and therefore they're at risk of burnout and frequent turnover. So in this critical pathway, we ask the question of how might we apply innovative ideas that reduce burnout and turnover, elevate and honor lived experience, and cultivate a workforce that looks more like the families we serve to build trust and better support an overloaded workforce. And then lastly, community collaboration. We were actually really surprised during our roundtables by how often concerns were raised about mandated reporting from both professionals and families. So on the one hand, mandated reporters have been made to believe for really generations at this point that CPS will just figure it out, even if their report doesn't rise to the level of maltreatment. And on the other hand, too often mandated reporters really want to support a family, but they lack the kind of coordinated systems and services that make it difficult to meet the family's needs. So as I stated earlier, in Wisconsin, and this is similar to many states across the country, nearly 9 out of every 10 families reported for neglect are not substantiated for maltreatment. So the question really becomes, how might we reimagine the role of mandated reporting so that reporters may provide the support that overloaded families need, rather than reporting them to child protective services who, frankly, are not designed to serve them?
Thank you so much. I think that's definitely a point well taken here in Florida, where under our law, every Floridian, adult Floridian, is a mandated reporter. And I think we've been having some similar conversations around that in terms of how we can divert some of those efforts to, like you alluded to, working more directly with families in more supportive ways. I did want to come back to you, Claire, and Luke mentioned this a little bit ago, but you and your colleagues at Chapin Hall have put out a number of reports on prevention-focused strategies to support parents and families. And like Luke mentioned, a lot of this has been on concrete economic supports lately. Could you provide some examples of what that looks like in practice and some of the outcomes that you're seeing with those programs?
Sure. And I want to give a little additional context as well. What is it that families are becoming overloaded with? And is this really solely about neglect? Are kind of a couple of questions I'd like to put on the table in order to then to think about, well, what are some of the policy solutions that we might come to? So we increasingly understand that economic shocks and cumulative material hardship in the lives of families are exponentially driving up risk for the activation and deployment of child protective services and the use of foster care. We know that the strongest predictors of investigated neglect are food pantry use and cutting meals, so food insecurity, short duration of residence and difficulty paying rent, and utility shutoffs, so some degree of housing instability and inability to receive medical care for a sick family member, so unpaid bills, shock as it relates to medical concern in the lives of families. And the most reliable economic predictors of child welfare involvement are income loss, that shock of some description in the lives of family, as I said, cumulative material hardship, and housing hardship. So there's some nuanced differences there between the strongest predictors of investigated neglect reports and economic predictors of child welfare involvement. But I think it's important for us to kind of understand what is it that's overloading families so that we are better at addressing those, so that we are not waiting or using this child protection services that is financially quite expensive, as well as eroding human capital and long-term well-being and adult productivity in the lives of families and children. We also know that this is not just about neglect. Let me talk a little bit about these economic shocks or material hardships as it relates not just to neglect, but for abuse as well. There's a study from 2015 that looks at families who are receiving temporary assistance to needy families or part of the self-sufficiency program. And those families that experienced at least one material hardship had a 3 times higher likelihood of a neglect investigation and a 4 times higher likelihood of a physical abuse investigation. And if those families experience multiple types of material hardships, particularly after experiencing no hardships, they are 4 times higher likelihood to receive a CPS investigation across all categories and a 7 times higher likelihood of a physical abuse investigation. So something's happening here that I don't think that we have understood well. When you look also at the evidence of our policy choices, what you see is that there are numerous policy choices that seem to have an effect on the extent to which risk of CPS involvement is increased. We see that across reduced benefits from temporary assistance to needy families, lack of access to childcare, lack of stable housing, those income or earning shocks, reduced employment. And we also have one interesting modeling study showing that when gas prices are increased, the risk of involvement with child welfare goes up as well. That's an economic shock or less discretionary money in the lives of families. And so this relationship we're beginning to learn more about. On the converse side, if economic and concrete supports are increased in the lives of families through a variety of mechanisms, whether that's a macroeconomic support, like a tax credit, earned income tax credit, child tax credit, employment supports like increases in the minimum wage, the availability of paid family leave, concrete supports like healthcare and Medicaid coverage, home visiting that includes economic and concrete supports, childcare, housing, public benefits like temporary assistance to needy families, supplemental nutrition assistance program, the Women, Infants, and Children's program, which are both food-based programs, and child welfare services that include economic and concrete supports. We see the risk for involvement in child welfare go down. And let me also just talk about 1 or 2 of the studies that help us to understand that this is not just neglect that we're talking about, it's also abuse. It's not only triggering investigations, but also the entry into foster care, where we're seeing these policy choices, whether it's a restriction or an expansion of resources in the lives of families, are having an effect. Let's just talk about the earned income tax credit for a moment. We have one study related to the earned income tax credit showing that refundable state level earned income tax credit is associated with about a 13% decrease in hospital admissions for abusive head trauma for children under the age of 2. I think what we have seen from the research across, at this point, almost 40 years of research, with a variety of studies, some that are randomized controlled trials, which is the gold standard. We have a few of those studies, and a number of studies showing the associative or correlational relationship with increased or reduced access to economic and concrete supports in the lives of families. This really interesting relationship with the activation and deployment of child protection, with the use of foster care, and with abuse, particularly abusive head trauma for young children.
Such interesting statistics, Claire, and I appreciate you explaining what those nuanced definitions and connections are to us. I'd like to end our conversation by asking you both, very simplistically, if you could wave your magic wand, what would be the piece of prevention that you'd have fully implemented right now?
What we have found, Lisa, to be frankly most promising and most inspirational over these past couple of years with our initiative and through the podcast most specifically is the power of storytelling and changing the narrative that can lead to changes in how people think about overloaded families and child neglect. If we are going to prevent child neglect, we must prevent the overload of stress that too many families experience due to the many issues that we've discussed today. And storytelling can occur in many different ways, right? We can tell the stories of a family who is struggling with financial insecurity, who's struggling to find childcare, who feels isolated from a support network that can help them navigate the challenges like poverty, like generational trauma. We can also tell the story that Clare has told today, which is that there are policies, there are practices that are proven to reduce the stress in families' lives, that are proven to reduce child welfare involvement, that bring greater awareness to our communities, to our leaders, to our policymakers, that can ultimately lead to better investments in our communities, better policies and practices that have real life impacts. The power of storytelling, the power of changing the narrative is that it really helps us challenge our mental models, which oftentimes are the kind of deeply held beliefs that are really the transformative lever of our systems change efforts that help us start to reflect on this idea of poverty or this idea of neglect or child maltreatment as not necessarily a sign of personal failure or bad parenting. Our mental models, systems change language for our deeply held beliefs, have often created a narrative in this country that poverty is a sign of personal failure or sending a child to school hungry is due to bad parenting. Through the podcast and other events over these past couple of years, we have listened to family stories and to systems experts like Clare and begun to shift the narrative that recognizes that often system failures and shortcomings are overloading families with stress and making them vulnerable to child neglect. That narrative shift leads to changing hearts and minds, which can begin to change how more and more people behave when confronted with the choice of reporting a family to CPS or supporting them by stepping up directly or referring them to the supportive services that they may need. This can also lead to changes in how our policymakers see overloaded families, potentially opening the door for more investment in economic and concrete supports, social infrastructure, and more prevention systems rather than protective and intrusive systems. And when we start to shift our thinking in that way, it can lead to better policies. It can lead to greater investments in upstream approaches. It can lead to somebody deciding to lend a hand rather than report to Child Protective Services. So I think the power of storytelling, I think the work that you're doing here, bringing greater awareness to what is happening in families' lives, as well as what is happening at the policy level and at the practice level, is extremely important and oftentimes underappreciated.
I'd like to thank all of our guests for sharing their knowledge and experiences with us today. If you're interested in learning more about this episode and our guests, please visit our website at www.ficw.fsu.edu. You can also follow the Institute on Facebook, Instagram, Twitter, and LinkedIn at FSU Child Welfare. Thank you to our Director of Communications, Emily Joyce, our producers, David Heller, Brantley Jones, and Alina Bachman, and our audio engineer and editor, Izzy Kring. Finally, thanks to all of you for tuning in today. I'm Dr. Lisa Magruder for the Florida Institute for Child Welfare.